Did we do the vote?
I think so.
Okay, so it was moved by Brian, seconded by Mitch, that the board elect Sue Patterson. Do I have any objections to that motion? Seeing none, that is carried. Okay, can I pass it on to Sue to do elections for vice chair?
Thank you very much, Erin. First of all, I want to say it's an honor and a privilege to be elected chair, so thank you for your support. And I look forward to working with the board and Dr. Era and the great staff here at the health unit. And at this time, I want to thank Mitch, our outgoing chair. Mitch, thank you for your leadership the past 2 years. You've always been dedicated, you're professional, you're loyal, and you bring a wealth of experience to the table. So on behalf of the board, thank you very much for your leadership, especially during amalgamation talks and of course, COVID. Thank you, Mitch. And we would all clap if we could.
Hear, hear.
Thank you very much, Sue.
Yeah, it's appreciated. Okay, so we need to elect a vice chair. So nominations are open for the position of vice chair. Someone needs to put a nomination forward, please.
Okay, it's Brian. I'll happy to nominate Brian Milne.
Do we have a seconder?
I'll second that.
So that was the first call. Second call for
Yeah,
nominations.
I hate to interrupt, but do we need, so typically it's been, if the chair is Grey County, the vice chair would be a Bruce County member?
That has been tradition in the past.
Yeah, so just kind of throwing that out there to the board.
I think, Madam Chair, this time around, though, we are looking at a double for Grey County. I think we talked about the next 2 chairs would be from Grey County.
Sorry,
Yeah.
I thought it was the next chair would be from Grey this year and next year, as Mitch was the last 2 years. So the vice chair typically should be a Bruce County director.
That was my recollection, and I was going to say that when it come to the point of asking whether the nominee would let their name stand. But so I'm going to be upfront here, and I'm a little out of order. But I was going to say that if someone from Bruce County is nominated, I would decline my nomination. But I'll leave that in the hands of the committee.
Yeah. So that leaves a limited number. Chris or Ann, either of you interested in the position, knowing that it would probably lead towards, I suppose, heading toward a chair position?
I think Ann's not on the call, is she?
Oh, that's right. Yes, she's not. Yeah.
But
Now's a good time to vote.
I think Ann would be interested in it, but I don't like to nominate people when they're not here.
Well, the railroad is alive and well.
How about yourself, Chris? Would you be interested?
Yes.
So we need second call for nominations.
Madam Chair, is this something that we need to complete today? In other words, we know that Chris is interested, and it could be wait until the next meeting and elect a vice chair then, depending on Ann's response.
I think
we could wait. I'll talk to Ann, but she might be showing up later. But anyway,
Yeah.
then that would be out of order on the agenda. But
That's okay. Let's defer it if we're allowed to do that. I don't know. There's nothing in the policies that says we can't. We need a chair for sure. So we can defer it to either later in the meeting or to the next meeting, whether Ann is able to attend today or not, if everyone's in agreement with that. So I can't see everyone, so I'm assuming you are. So moving on with the agenda, we have item 3, which is amendments to the agenda. Are there any amendments this time? And I'll look towards Dr. Era or Matt.
So, Madam Chair, congratulations first on the chairmanship. There is one proposed item to accept the appointment of the new board member to be added possibly at the start of the agenda.
Okay. Do I have a mover and seconder for that?
So move, Madam Chair.
That's Mitch and
Second, Millen.
I did see Brian O'Leary. I was reading lips because he was muted, but
I will second Mr. O'Leary's motion, Madam Chair.
we have Mitch and we'll take Brian O'Leary. Anyone opposed? Seeing none, that's carried. So we have the approval of the agenda as amended. I need a mover and seconder. Brian, I'll take you on this one. Brian Millen to
All
move
right.
it.
Yep, thank you.
And seconder. You have to speak up because I can't see the whole screen.
Brian O'Leary.
I'll second that. Oh, go ahead, Brian.
So we have the 2 Brians. Anyone opposed? That's carried. Thank you. Is there a disclosure of pecuniary interest or a conflict of interest? Seeing none, and of course, if one should arise during the meeting, please declare it then. And adoption of minutes from Friday, November 27th. Any discussion with those?
So moved, Madam Chair.
Thank you. Moved by Selwyn, seconded by
Peabody.
seconded by Chris. Thank you. Anyone opposed? That is carried. So Dr. Era, before we start with correspondence and news releases, you can do your item for the amendment, please.
The item, Madam Chair, is just to have a motion to accept the appointment of the new provincial nominee, Ms. Stingling.
Okay, so we need a mover and seconder.
Tulin.
I'll be happy to move or second now, Buck.
Okay.
But
So
I'd
we
love
have-
to find out a bit about our new nominee.
Yes. So what I thought we would do, if we could go around the table, I'll just ask each individual and then we'll ask Helen Claire to introduce herself. So Mitch, let's start with you.
Well, first off, welcome to the board, Helen. My name's Mitch Tulin. I'm the past chair of the health unit, and it was a privilege to serve in that capacity for the past 2 years. It's almost like me and Dr. Air are going to be breaking up after today because we've been back and forth every single day for probably the last several months. So I want to reassure you, you're joining a very well suited and people that really care about our community. So welcome to the Board of Health, and it'll be nice to get to know you a little bit better.
Thanks, Mitch. Al Barfoot.
Sure. Good morning, Helen. My name is Alan Barfoot. I was actually also a past chair of the board. I was former mayor of Georgian Bluffs and also warden of Grey County for 2 years. I have actually applied to also be a public appointee and went through the same process, obviously, that you've gone through. I talked to my contact the other day and he advised me that it's his wording was it's still in the hopper. So he said it could come through, but it's obviously subject to cabinet approval, the same as what yours was. So anyway, I hope to be on the board as a permanent status soon. So as I say, welcome aboard. And it's a great group and a great learning experience.
Thanks, Al. Chris?
Yes, I'm Chris Peabody, the mayor of Brockton.
Okay, thank you. Brian Millen? You're muted, Brian.
How many times a week do we hear that? You are muted. Wow. Anyway, good morning and welcome. My name is Brian Milne. I'm Deputy Mayor, Township of Southgate, former mayor, former warden of Grey County. Yeah, it's a great group, and Dr. Eyre does a stellar job leading us, and welcome.
Okay, thank you. Brian O'Leary.
Thank you. Welcome, Helen. I'm Brian O'Leary, Deputy Mayor, City of Owen Sound. I'd also like to thank Mitch for everything you've done with the board and your relationship and support with Dr. Ara. So thank you very much, Mitch.
Thanks, Brian. Selwyn.
Hi, Helen. Good morning and welcome. I'm Selwyn Hicks. I like to be called Buck, so I'll train you right off the hopper. Our chair is reluctant to call me Buck, but I'm Buck, and so feel free to call me Buck. I'm the deputy mayor for the town of Hanover and the current warden for the county of Grey. Yeah, and I've been with the Board of Health for 2 years now.
Good. Thanks, Selwyn. Anne Edie hopefully will be joining us later. She's the mayor of Kincardine, so we'll introduce her when she does join us. I'm Sue Patterson, mayor of the town of Hanover, so welcome. We look forward to working with you, and you can share with us. Introduce yourself, Helen. You prefer Helen Clare or Helen?
Helen Clare is my name, and
Yes.
I will. I'll take a feather from Buck's hat here, and people can call me HC if they like, if Helen Clare is too onerous. I am really, really happy to be joining this board. I have lived in Hanover. Actually, I really live in Bentic, Old Bentic, but the side of the center of the road where the delineation takes place puts me on the side of Bentic, and if I cross the road, I'm on the side of Hanover. So that's why my ordering council says Hanover, because that's my mailing address on a rural route. I have lived in the same house for 30 years. However, my work has taken me all over the province. Most recently, I've worked for the federal government in the integrity branch, and but I have all the work that I've done in the last 30 years has been for community. Large part of my work has been using the arts, particularly theater, to educate on social issues like addiction, mental health, homelessness, poverty, alcoholism, a lot of the things that intersect, of course, with health. And as COVID hit in the beginning of the year, and I started, of course, was able to come back permanently to my home and not be on the road, I kind of reevaluated where I am in my life and what I want to be doing, and recognized that I wanted to contribute at a higher level than what I felt I was doing. So at that point, in the spring, I applied on the Public Appointments Secretariat. And looking at what was in my community, I was quite appalled to see that the Health Unit Board that does such incredibly important work was short 2 provincial nominees. So of course that box was easy to check. But prior to checking that box, I want to let each and every one of you know that I read up on you, and I read up on Dr. Ara, because I wanted to make sure that I was joining something that was highly functioning and highly competent. And after my research, I was persuaded that that is the case. So undoubtedly, all of you on this board under Dr. Ara's leadership have been tasked with such an extraordinary year and incredible challenges in this year that you have met somehow, even being short. So I promise you that you will have my passion, my dedication, and my desire to come up to speed as quickly as possible. And I want to contribute at my highest and best level to this board. And thank you, each of you, for welcoming me so warmly.
Oh, thank you very much, Helen Clare. You can be assured we will be calling on you for some of those skills and the knowledge that you have and your experience. So welcome aboard. Thank you. Okay, so we'll move on. We have item 7 which is correspondence and news releases. Dr. Era, did you want to comment on any of those, or Drew, whoever?
Certainly. Thank you, Madam Chair. Regarding correspondences, there are three of them. The middle one, 7.1.2, is definitely an item that is worth endorsing, and that's recommendation to the board to endorse it and receive the other two. And it lends itself to the fact that, during COVID, locally in Grey Bruce, we have had the relative success of 0 death related to COVID. However, we have over 15 or at least 15 anecdotal deaths related to opiate. So this correspondence advocate to the federal government and to Ontario government to recognize, acknowledge, and declare opiate overdose as a crisis that we need to tackle. And as a matter of fact, later in the agenda, as you know, Madam Chair, we have a standing item related to this crisis, and it would be very appropriate, or it was my thought to ask the board for a motion to increase the awareness about this crisis, and potentially maybe putting a motion to say, as soon as we finish dealing with the pandemic, to have the opiate as a first priority, opiate crisis as a first priority. So that's my recommendation for the correspondence, Madam Chair.
Thank you. Any discussion? Can I get a mover and seconder to endorse the National Opioid Strategy?
Anybody?
Thank you. Seconder?
Milne.
Thank you. Any opposed? That's carried. Thank you. Dr. Era, anything with the news releases? Lots of them, of course.
Madam Chair, the most significant aspect of the news releases is the COVID cases associated with schools. We've had multiple occasions and or situations, and universally in all of them so far, there has been 0 transmission to secondary cases in school, and that really speaks to the high level of collaboration with the school officials, with the public, with the healthcare system. And that can be a clear trend in these news releases. The second aspect is the opiate overdose alert. Over one weekend, there were 2 deaths related to opiate overdose, and the health unit had an optimal response, considering that we're in the middle of COVID emergency. So that was a release related to that incident and response.
Thank you. So we need a mover and seconder to receive the remaining December correspondence and the media releases as presented.
O'Leary.
Thank you. Seconder, Mitch, thank you. Any opposed?
No, but I have a question, Madam Chair.
Yes.
Doctor, just wondering if you could comment on the opioid crisis versus last year. And I don't mean to put you on the spot, but how much more of an issue do you think it is this year versus last?
So far, the numbers are consistent that there is no change since last year. That seems as a stable number. However, a stable number of deaths is by definition not the success. Rather, our goal was to have the trend going down. So that's in short the situation.
Sure. Okay, thank you. Thank you.
Okay, so it was moved and seconded. I'll ask again, any opposed? That's carried, thank you. Item 8 is the Medical Officer of Health update. The first one, 8.1, is the COVID-19 vaccine proposal. Dr. Era, please.
Thank you, Madam Chair. If we can share the screen, the proposal, please, Aaron. Would we be able to?
Sorry, just give me a second.
So, Madam Chair, we have been planning for the arrival of the vaccine for a period of few months now. The plans for distribution started late August, and we have, by definition, as a health unit, the mandate to distribute vaccines. If I may, sorry, I'm just going to ask for the mouse to be passed to me. The recent information about the vaccine that requires different logistics requires a change in plan or plans. And like emergencies usually tend to be, there are, I can't move this slide, please. If you can go to the executive summary, that would be great. Thank you. Sorry for the technical difficulty. If you can go a little bit more, please, down. The mission. Thank you. So like emergencies tend to be information, there are gaps in information just because things are moving quite rapidly. So the best practice is to plan based on assumptions, to have several plans and narrow them down based on the scenario there is. And we now know that one of the plans for the Pfizer vaccine that requires minus 75 Celsius ultra cold temperature is the one that's probably be rolling out or rolling out. So we were proactive to communicate with partners, local partners, whether it's hospitals, healthcare providers, or local companies. And as you know, Chapman's Ice Cream have freezers, and they have the expertise in handling dry ice. They had the will to support the initiative, and we pursued two options: one to build a freezer, the second one to order freezers, and the second option has been more practical. So 2 freezers will be arriving to Grey Bruce next Monday or Tuesday. That's the last estimate I had communicating with Chapman's. Bruce Power also put an order for a small freezer, and they are willing to support, as they have been, with communication and other logistics, whether a security assessment of the locations. The 2 main plans, Madam Chair, for distribution of vaccines are one is related to the traditional distribution of vaccine to healthcare providers, hospitals, long-term care, and that will be with the Moderna vaccine and similar vaccines that could stand the regular cold chain. Cold chain is transfer of vaccine within a range of temperature between 2 to 8, and that would be the easiest option. However, we're prepared for the first role or the first type of plan, which is the Pfizer, to, instead of distributing vaccine, is to transfer patients to a central location. And in both plans, the distribution would be through mass immunization clinics. And that's a specific function of immunization that public health is the expert and has the legal authority. And I'll explain both expert and legal authority there. We do this on an annual basis when we vaccinate school kids. That's mass immunization clinic, and it doesn't require a healthcare facility. It's preferably not to be a healthcare facility because we're not dealing with one patient at a time. We're dealing with more or less an assembly line of vaccination, or if I can use that analogy. And we do it very effectively. The legal authority comes from, it's not a regulatory authority, I would say. Forgive me getting technical. The patient-physician relationship should exist before ordering any controlled act. And controlled act could be injection of medication, or could be prescribing medication, could be a surgery. There are 13 controlled acts, and they should not be delegated to somebody other than the person doing the job, unless they could be delegated. However, there should be patient-physician relationship. So a physician cannot really delegate to somebody the injection of a vaccine unless they have seen that patient. The exemption to this comes from the College of Physicians and Surgeons that says this could be exempt if we're dealing with mass immunization, for example, and that should be under a medical directive from the medical officer of health to allow for injection of vaccine without the medical officer of health knowing every patient who's vaccinated. So with that in mind, we put a plan forward, and we have communicated with local partners, and we have a tremendous support, and it's heartwarming to see the response from the healthcare providers in Grey Bruce and health organizations and non-health organizations to volunteer their resources. And we have composed a list of these volunteers with categories. So all in all, we have the ability, the expertise, and the legal framework to execute these plans. And we sent the proposal to the province last Sunday. There has been communication in general about vaccination and the role of public health in the vaccination, and the partnership with the hospitals where possibly the vaccines will be stored down the road based on the provincial direction. So more or less, Madam Chair, we are ready to roll the vaccine out in Grey Bruce under different scenarios. And as soon as we get the direction from the ministry to do so, we will be able to do it. It's worth mentioning that the proposal has the benefit of 3 points for benefit of rolling it in Grey Bruce as a pilot. The criteria that's being used currently by the province is high-risk areas, hotspots are the 2 pilots, Toronto and Ottawa. However, we do see that if we're able to eliminate the risk of transmission or the risk of the danger of the pandemic, which is specifically stalling the healthcare system in the hospital, if we can eliminate it, and we can, according to our plan, within 8 weeks, we can deploy our resources, whether it's the health unit resources or the hospital resources, to support hot areas in the province. So that's another layer that would add benefit not only to residents in Grey Bruce, rather to all Ontarians. And it will be a good example that's generalizable to the rest of the province. That's the second point of benefit to the province. Toronto and Ottawa are not representative of the majority of the province. The majority of the province is small, urban, and rural. And Grey Bruce fits that description. So providing lessons learned from a successful pilot in Grey Bruce would, again, benefit the majority of Ontario. So with that proposal, we put it forward, and we're waiting for direction from the ministry. I'll stop there and open to question, as always, Madam Chair.
Yes. Selwyn?
Thank you, Madam Chair. I read an article in the newspaper in which it seemed to be announced that Chapman's Ice Cream would be involved in the distribution of the vaccine in some way. I assumed from that article that there has been some sort of response from the province to Dr. Ara's proposal. Have you heard, Dr. Ara, anything at all from anyone at the provincial level?
So we have communicated with the provincial level. There isn't direct approval of the proposal. However, we are listed on certain, Grey Bruce is listed on certain lists for potential pilots related to the distribution of this Pfizer vaccine. Sorry, if I may, Madam Chair, through you, explain. Many of these things are moving fast, and there are certain level of confidentiality with how the plans are rolling, just because they're not finalized at this point.
Understood, Madam Chair. Just to finish, I'm hearing from Dr. Ara that there may be things that he's not able to fully disclose, and I completely understand that. But I would have thought that someone from the province might be at least inquiring, seeking additional information or clarification or something like that.
I can say, if you were on the call with the Premier and General Hillier, Mitch, as chair, put a good plug in for Grey and Bruce and Chapman's, and General Hillier did reply that he was taking note of that. So that was a good plug, Mitch. Thanks for doing that. Al, did you have a question?
I do, Madam Chair. I just want to congratulate Dr. Ayer on an excellent proposal that he's put certainly an awful lot of work into it. I'm not sure if you can answer this question or not, but in your proposal, you had mentioned working with a neighboring health unit. Are you at liberty to say which one you think you might work with that, or are you just leaving your options open on that?
Totally down.
We're working with Huron Perth on initial steps to see how we can share plans, how we potentially can share the freezers. We have 2 freezers. Not everything is finalized, and again, the provincial direction might change our ability to basically implement in both health units or in one. But as always, collaboration with another organization would only add benefit to the cause.
Okay, thank you.
Any other questions for Dr. Ayer?
Madam Chair, it's Brian. I have a
Yes.
question. I too first want to congratulate Dr. Ayer on this pilot. It's an incredible amount of work and detail that's been put into this. My question is, you talked about giving 15% of the staff to long-term care because of in case of side effects. Are you expecting side effects or expecting a problem with that, or is that just kind of a safety net?
Through you, Madam Chair, with any vaccine, there will be a reaction to the vaccine by definition, because that's the way immunity is built. And usually there could be fever, there could be redness or swelling where the injection site is. With this vaccine, is about 50% of the estimate of last read, 50% of people who will get the vaccine might have one of these reactions. And because fever and other symptoms could be related to COVID, we need to be on the conservative side. And if a person develops these symptoms, they will be in isolation or not able to go to work in long-term care. So that's going to increase the absenteeism rate. So if you can imagine in a scenario where we'll vaccinate the whole facility staff on one day, that means we're going to get 50% or around 50% of the staff not able to work. And that's where we move to the staged approach to vaccinate 15%, 15 to 20% at a time, then wait a few days, then vaccinate the other part. And this is consistent actually with what the province planned for too.
Okay, thank you.
Any other questions? Okay, thank you. Dr. Ayer, next item, the public health modernization update. Anything to share?
So that item, there are no update, Madam Chair, from the province on the consultation. It remains dormant until a future date.
Okay, and next, anything further on the opioid situation in Grey and Bruce? I know you did speak to it earlier.
Right, Madam Chair, through you again, the heavy finding, the hard finding this past couple of weeks of 2 deaths really ignited a response from all partners around the table, and public health was involved. In optimal, if there was no COVID emergency, we probably would have addressed the opioid crisis in more rigor. And I would suggest to the board to potentially have a motion to raise awareness to the other level of government, whether it's the federal or the provincial, that by the end of the COVID emergency, the momentum or the need to address the opioid situation need to be carried forward. And again, it's probably an item worth discussing to start with, and that would raise awareness, and whatever the board prefers to do, whether it's a motion or endorsement of the previous item, would be sufficient at this point.
I'll ask the board, what's your thoughts on that? Or do you want a new letter sent to the province? Or is endorsing okay? Any thoughts how we can move it up? I noticed Owen Sound has put in a Sharps kiosk, was it called, Brian? So hopefully that will get rid of some of the refuse of used needles. So thoughts about Dr. Era, did you want to prepare a letter that we could send to the province? Or do you think the original endorsement of correspondence is enough?
I see a value in preparing a letter and sending it to the province. It doesn't have to be, asking the province to act today, because that's probably is not feasible to be on many fronts, but to raise awareness about the importance of this issue.
Okay, that's good. We'll look forward to that for the next meeting, if possible.
Thank you.
Thank you. Next on the list is the physician consultant, the AMOH recruitment, an update on that.
So, Madam Chair, I'm delighted to share with you that we have provided the offer, and the physician consultant accepted the offer, and the start date would be February 7th. So that recruitment process is completed and successfully completed, I believe.
That's good news. Thank you. Any questions with any of those reports and updates for Dr. Era? Seeing none, I need a mover and seconder to receive the MOH updates as presented. I have Mitch, and I think I have Brian Millen. Any opposed? That's carried. Thank you. Corporate services, the financial report for October 9.1. So that's you, Matt.
Yeah, thank you, Madam Chairman. So you've got the memo that deals with our financial statements for the end of October, along with the commentary. It's clear that we are beginning to spend more than what was in our original budget, but that is completely expected. And frankly, I expect that to continue through the months of both November and December. That spending is largely in salaries and benefits, which is adding people to our organization as we continue to respond to wave 2. And again, we have the reliance back on the letter from the ministry saying if you're responding to COVID, your expenses for responding will be covered. So I look forward to making sure all that is provided to the ministry. I'll ask her if there's any questions on that report before going into the next sets of memos.
Thank you. Brian, you have a question?
Thank you, Madam Chair. Matt, my question is regarding your statement there that the province continues to assure us that they will cover COVID-related costs. Is there any indication of a timeline, like when they're going to reimburse us for those costs? Or is it just some imaginary date in the next decade?
I would say there's not a specific process currently in place for us specifically outside of our annual reconciliation that goes on. So if we were in financial need, as I've seen a few other of our health units, they have been receiving funding. We're not in that position in terms of financial need. So we will be able to reconcile somewhere in the April timeframe when they get that report comes through. Reconciliation means money, and it usually will take another 2 or 3 months for that to happen. So in the normal course, it could go speedier. I've seen that happen with some other health units.
Okay, thank you.
So it's not.
Thank you. So the short answer is no. Okay, thank you.
Further comments, questions? Okay, Matt, if you want to move on to 9.2.
Thank you. That's the procurement of the dental compressor and vacuum. This is a piece of equipment that from our purchasing policy did fall outside. There was a conversation with the chair earlier so that we could approve the purchase order. This also has the opportunity of being rescinded, but if that's going to be the case, there will be some additional costs. This is for a procurement process. The request is because we're outside of our stated process, and I'm also cognizant of the request from the board from the previous session saying, please review your procurement processes and limits. Unfortunately, that process is not complete. I hope to have that for the board for the next board meeting. However, we're still dealing with this other financial piece. Expect the equipment to be fully utilized. It is for our seniors dental program. So we look for approval of this purchase.
Any questions? Okay, I need to check a housekeeping item. Aaron, can we do one motion for all of these reports, or do we need to do them individually?
I think we need them individually. But yeah, one to receive the financial report, one to approve that dental purchase, and then one. Sorry, we could do one to approve the dental purchase. I think there needs to be one for the specifically for the wage increase, specifically for the vacation, and then you could do a general one to receive the remainder of the reports. Does that make sense?
But we do need one for the financial report. So I need a mover and seconder for that. Let's take a step back. And I have Brian and
Peabody.
And Chris Peabody. Any opposed to the financial report for October? That's carried. Thank you. So then the dental equipment for the air techniques, compressor and vacuum. Any questions about that process, or are you comfortable with it? Seeing none, I'll ask for a mover and seconder. Selwyn and Mitch. Any opposed? None, thank you. So then Matt, insurance coverage will follow in order.
Thank you. Thank you, Madam Chair. So I'm providing you with a information on our in confirmation of coverage that we continue to have throughout for all of Grey Bruce health units, assets and operations. There is no change in the limits with the exception of property that has been steadily increasing, albeit at more or less the rate of inflation. Same with the deductible, those have not changed in any specific amounts.
Okay.
They present as information.
Right. Next, 9.4, the non-union staff and the management wage increase.
So there's for our non-union staff and management, we've reviewed and you will have in camera, there will be a piece on both the OPSU, ProTech and Sport pieces. However, dealing with what has already been approved and what's been proposed, management also puts forth a recommendation for dealing with the balance of the human resources within our organization of 1.5% for 2021.
Okay, questions, comments? I need a mover and seconder for that. I have Mitch and Brian Millen. Any opposed? Okay, that's carried. And then we have the vacation payout.
Thank you, Madam Chair. There are 23 staff members that have a total of 85 days of vacation due. Has a gross amount in terms of impact to our organization of $36,000. This represents time that cannot be taken. It would be lost as we carry over from 2020 to 2021. Given the response to COVID, many of these individuals have not been able to take their full vacation allotment. So this is the amount that sits over a specific carryover amount. So that covers our entire organization. Depending on which union it is and bargaining unit, that carryover is slightly different in terms of hours. And then there's also the non-union side as well. But that 23 spans the entire organization.
Okay, thank you. There's two questions, one from Al and one from Brian Millen.
Thanks,
Al?
Thanks, Madam Chair. Matt, do you think that would fall into the category of additional COVID spending or not to be able to pay that out?
100%.
Oh, okay. Because I guess that without COVID, they would have been able to take their vacation. So
absolutely, extraordinary circumstances, the COVID-19 response and the heavy utilization of all of our resources.
Brian?
Thank you, Madam Chair. My question revolves around a concern that our staff are not getting their vacation time, and it's going to absolutely burn them out if we don't let these people take some time off. Now, I'm not suggesting that people are not taking some time off, but this is, in my mind, this is a dangerous slope to go down just to pay them out and keep them hammering away at the door. I'm a little nervous about this, because if these people are not getting time away from the office that they're entitled to, we're getting a short-term gain for a long-term gain in my mind. So I hope this doesn't continue beyond certainly the crisis that we're dealing with. So it's just a concern that I'm worried about, and I don't want to see this continue on too much more.
Madam Chair, through you. So that was the same concern we had, and that's why during the summer we asked everybody to take their vacation to the best of their ability, and we didn't insinuate in any way that this vacation will be compensated if it's not taken. And we kept that messaging until early this month, I believe, when we realized that everybody who could take vacation has already taken it, and this is relatively a small number of people and days comparing to what it would have been if we did not push towards that people take vacation. So I agree 100% with your concern, and it is my concern as well.
Thank you.
Okay, good. So we need a mover and seconder to approve the vacation payout. Selwyn and Brian O'Leary. Any opposed? That's carried. So then we need one final motion to receive, which leaves just the insurance coverage update, to receive that report as presented. I need a mover and seconder. Brian Millen and Mitch. Any opposed? That's carried. Thank you. So thanks, Matt, for that. So we're on to other. We have the all staff holiday lunch options and an update. Who's taking that one?
So, Madam Chair, I can speak in general about it, and if there are details, Matt can definitely speak about the financial. So last time we met, we brought to the board that usually we have lunch for holidays, and because of COVID, we decided to provide a gift card, and there was a question whether it's going to be taxable or not, and the solution was found to provide a voucher that's non-taxable to our staff, so that they can have that gift completed as if it was financially provided in the health unit. So if you have any question about the details.
Any questions? Okay, good. Next, all staff holiday Zoom. You're having a party on Zoom?
Correct, Madam Chair. We will have a staff holiday Zoom, and by definition, the board is invited if they wish, whether if you have the ability to be in person live on those Zooms, or if you wish to send a recorded message or a verbal message that I can deliver on behalf of the board. One of these three options, or any other option you think of.
And what's the date?
Aaron or Connie?
Tuesday the 22nd is the meeting.
Tuesday, 22nd.
Okay. At what time?
9:30.
9:30.
Oh, it's an early party. So, if you want to join, you can. Can we suggest that Aaron send a link out to the board? That would be good, and then you can decide what you want to do.
Certainly, consider it done.
Okay, or if that's not possible and you want to get a message through to staff, you could send it to Dr. Era and he could share it with staff during the party. So, okay, good. We did public appointments update. I think we've done that. Correct, Dr. Era? Yes. The draft 2021 Board of Health meeting dates. Any issues, problems?
So if I may turn the answer or the question to Aaron.
Oh, it's just for information and I guess discussion if you want to continue with the fourth Friday of every month. That is what is presented there. Otherwise, open to suggestions.
I think it's been working well, at least for me, when you know your fourth Friday is booked. So. Okay, I don't see any
I know
issues.
O'Leary likes the fourth Friday of the month because then he can go golfing after lunch.
Okay,
My only question, Madam Chair, for Mike is, does it work for HC?
HC.
You see?
Right. Helen Claire, are you okay with the fourth Friday?
Absolutely, no problems here. Thanks,
Okay.
Buck.
All righty, so that's the last for other. So we need a motion to receive those 4 updates and reports. I need a mover and seconder. So I have Brian O'Leary and I have Chris. Any opposed? That's carried. Thank you. So it is recommended that the Board of Directors of the Grey Bruce Health Unit meet in closed session in order to address matters pertaining to security of property, labor relations, and employee negotiations, and to receive advice that is subject to solicitor-client privilege, including communications necessary for that purpose. So I need a mover and seconder to go into in camera. Chris and Brian Millen. Thank you. Any opposed? That's carried. We are now in closed session and we'll just wait for Erin to do her thing on the live streaming.
On the board.
Great. Donate it to the food bank.
Okay, I think we're live.
Okay, thank you. We are now in open session and I declare we only discussed the items that were on the closed meeting agenda. During that meeting, we gave direction to staff, and from that meeting, we have one motion. So we need a mover and seconder. We have agreed to approve the 2 contracts for OPSU. I have Brian Millen and Brian O'Leary. Any opposed? That is carried. And that is the end of the agenda for our open meeting. And I'd like to wish everyone a Merry Christmas And a happy new year. Stay safe and follow those 3 W's. Wash your hands, watch your distance, and wear a mask correctly.
Thank you,
That's it.
Madam Chair, and Merry Christmas to all.
Merry
Yes.
Christmas. Stay safe, everyone.
Merry Christmas,
Yes.
everyone.
Merry Christmas.
Merry Christmas, everyone.
Take
Merry
care.
Christmas.
Oh, you know what? I need a motion to adjourn.
No, you don't. You just declared the meeting's over, so I guess we're done.
We have Selwyn and HC. You can adjourn. Okay.
Sure.
Thank you.